she wanted to have the baby here in the United States.
The United States is one of the few countries in the world that grants citizenship, no questions asked, to any baby born within its borders.
That entitles them to everything that the American citizens are entitled to.
Welfare?
Yes.
Food stamps?
Yes.
Education for their children?
Big time.
All paid for?
By us.
I'm Mike Wallace.
I'm Morley Safer.
I'm Ed Bradley.
I'm Steve Croft.
I'm Leslie Stahl. Those stories and Andy Rooney tonight on 60 Minutes. We are one of the few countries in the world that grants citizenship, no questions asked, to any baby born within our borders. It's in the Constitution. It makes no difference that the mother is here illegally. Her son or daughter has the same rights as you or I or anyone else born in the USA. There are those who say that's how it should be. That's what's written on the Statue of Liberty. Give me your tired, your poor, your huddled masses yearning to breathe free. But there are also those who say, with our social services overburdened and underfunded, we cannot afford to take in those huddled masses anymore, especially pregnant illegals. By law, they cannot be turned away from hospitals when they arrive there, about to deliver yet another American citizen to the welfare rolls. The emergency room of Sharp Medical Center in Chula Vista, California, just north of the Mexican border. Dr. Jim Packer says the illegals wait until they're actually in labor before they show up. Why do they wait to the last minute like that?
Most people are aware that they need to come here when they're in labor and just ready to deliver. Because if they're a month early and there's no danger, we can monitor them, we can make sure there's no danger, let them go back down to Mexico. Frankly, in a month, they'll be right back up here, a little more savvy this time.
In the emergency room, you take anybody who comes through that door?
That's correct.
No matter whether they can pay you, can't pay you, illegal, legal, you take anybody?
When we first see them, it's not an issue, period.
Up to 2/3 of the births at some hospitals in California are to illegal aliens. Sally Super runs the nursing staff on the maternity ward at the Sharp Hospital Center.
We believe that there's a network out there that tells them when to present to the hospital, what to do, what to say, how to do things. And so when they present, they know exactly, they've been coached by somebody so that they know what to do. So we believe that there's a network out there. That network ends up costing the taxpayers of San Diego a lot more money, according to County Supervisor Brian Bilbray.
We've got hospitals that have a large percentage of the people that show up to their emergency wards are illegal aliens, state that they're illegal, and basically have to be served by federal law. The hospitals know they can't charge, but for humanitarian reasons, and by legal reasons, they provide the services. And that ends up costing the rest of the people the price of having to make up for the services that wasn't paid for by illegals.
So why do you think they're coming here?
Why do I think they're coming over here? For the birth certificate. Because that entitles them to everything that the American citizens are entitled to.
Welfare?
Yes.
Food stamps?
Yes.
Education for their children?
Big time.
All paid for?
By us.
The benefits start with the free delivery. The same network that tells them what hospital to go to also tells them what to say to the hospital to get the bill paid with no hassles and no collection agencies. Here's how. Just get yourself eligible for Medi-Cal, California's version of Medicaid. Tell the hospital you're poor and use a California address of friends or relatives, even if you don't live there. Then you can go back, usually to Mexico, with the entire bill paid for by Medi-Cal. Unless, of course, Jim Mayfield catches you.
90% of the cases we investigate are pregnant women coming from either Tijuana or the interior of Mexico and sometimes other countries.
Jim Mayfield of Medi-Cal investigates benefit fraud. He goes door to door checking up on women suspected of lying about being a resident of California.
The landlord said that the people that are applying for Medi-Cal don't even live here. The only people that live here are a family that's on welfare. So we're going to go and find out who's exactly there.
Hello.
Can you speak English?
No.
Mika?
After talking to this woman who had a baby in a California hospital and claims to live here, Mayfield went to the landlord.
Is this person who I mentioned to you a legal resident of your apartment complex?
No, she's not. They want to get the benefits without, having the rights to do so.
Once they get Medi-Cal, then they're eligible to go to the hospital and have all their medical costs paid for. A typical pregnancy will cost about $3,000. The taxpayers pick that up.
100%.
100%.
After the delivery, the mother and baby, a U.S. citizen, often return to Mexico. If they try to come back to the U.S. through the border crossing, authorities there try to catch them and make them pay the bill even years later. How do they do it? Well, here's one way: the border crossing card. It allows residents of Mexico to cross the border for 72 hours to visit relatives or shop or do business. But they must be residents of Mexico to get the card, and that's the catch. If you're a resident of Mexico, how come California paid for the delivery of your baby? That's what the INS asked this woman, who told them Medi-Cal didn't pay for her U.S.-born baby.
Okay, she claims that her husband paid $60,000 for the baby, so we're going to find out now, and we're going to give a call to Medi-Cal also to see if she has a record on file.
Another woman is the same story. Both of them are brought upstairs to a Medi-Cal investigator, George Tower. The women fill out a declaration, including the question, were you ever on Medi-Cal? They both answer no. Tower calls the office in San Diego to see if either woman shows up on the Medi-Cal records.
She had the babies here in the United States,
And
this one in the
Medi-Cal
county
paid
of
for it.
Los Angeles, and Medi-Cal paid for it.
And she is not a citizen of the United
And
States.
she is a resident of Mexico. Okay?
So she didn't tell you the truth?
She did not tell the truth.
At this point, the women will be given a choice. Either pay back the Medi-Cal bill or forfeit the border crossing card. Other than that, there is no punishment for what they did.
It's a shame that we can't work the full 24 hours down here because we find a lot more.
How much do you work?
I'm by myself, and
You are the only Medi-Cal fraud investigator.
that's right. Plus, then I have the...
Largest border crossing point in the whole country.
That's correct.
And you're all by yourself.
That's correct.
And what if the illegal and her baby stay in the U.S.? That child is entitled to everything any other U.S. citizen is entitled to, including welfare. Are the benefits in California that much greater than other states? In other words, is there a magnet for these people to come here?
I believe so. A woman with 3 children in California, including her AFDC welfare payments and her food stamp benefits, is getting in excess of $900 a month. Now, you can't flip hamburgers at Burger King and make that kind of money. Plus, you get free health insurance. So it's a great program. If the federal government is going to mandate that we provide health care and public assistance benefits, we'd like to be reimbursed. And right now, the state of California is not being reimbursed for about $3 billion worth of public assistance.
Well, that's a year. $3 billion a year.
$3 billion a year.
Even if the child lives in Mexico, he can go to school in the U.S. These children cross over every day to go to school in California, paid for by California taxpayers.
Going where?
School.
What school do you go to?
Marista.
All right, thank you.
I think our whole system has huge loopholes that just ask people to come in and take advantage of them. I mean, we have 4,800 people last year come to this county from a foreign country illegally to give birth to their child. 41% of them immediately went on welfare. Now, if you were poor in a foreign country and knew that you could get on and be able to get that kind of subsistence in the United States, you'd be crazy not to. So I don't blame the foreign nationals. I blame our system for just asking for abuses.
Who's paying for all that?
The local taxpayers are paying for that. The local taxpayers are being bled dry on this. We're shutting down parks. We're shutting down libraries. We're shutting down law enforcement protection to the citizens. And these are not wealthy citizens.
The frustration comes from the camcorders, the gold jewelry,
The gold
cars.
jewelry, the camcorders, what do you
Yes.
mean?
These people come in with lots of stuff, Leslie.
But they're not poor is what you're saying.
No.
Rich people coming in for services, going on welfare, getting free service.
Leslie, we have patients that come in that are physicians, attorneys, that tell that they're not employed or they're unemployed, they're housewives. They come in with their beepers.
We had one case to where there was over $400,000 of medical service provided to a certain individual. And the fact is, the family was very, very wealthy. But they could take a walk because they come over, get their service, and go back to Mexico, and there's no obligation to be able to pay back on those things. And the person got served.
And there was nothing?
There was nothing they could do about it.
Why not?
Basically because you've got an interesting situation in this country where the same federal government that says that it's illegal for a private citizen to hire somebody who's an illegal alien to not make sure that they're legal, that it's you can be fined and go to jail. That same government that requires the private sector to do that tells the government sector you don't even have the right to ask if they're an illegal alien, that it's illegal to restrict services or even ask about your national origin.
We got together a group who live along the border and asked them what they felt about all of this.
I think we need an amendment that makes only children born of legal immigrants legal citizens. If you enter the country legally, then by all means your child should be a citizen. If you come in here illegally, there's no reason why your offspring should be a legal citizen. We're inviting criminals. We're begging them to come and take advantage of our services, and then we're paying the poor Border Patrol to try to run them down and take them back.
Do you think that there should be a restriction on making those children U.S. citizens?
Absolutely not.
Viviana Andrade is an attorney with the Mexican-American Legal Defense and Education Fund. Why not?
Because I think it is very basic to our notions of the United States as a government that it would confer citizenship to individuals who are born here. To me, that comes from the 14th Amendment Citizenship Clause. I shudder to think that we would turn out to be like Kuwait or Germany or Japan. And those countries are all countries that grant citizenship based only on the parents' blood.
In downtown Los Angeles, this street rally joins together human rights and Latino groups who think that what's happening now in California is immigrant bashing, blaming immigrants for everything that's wrong with the California economy.
This repression, this prejudice, this racism against the immigrant community.
Immigrants didn't cause the SNL scandal. No one wants to talk about all the people who clean up and feed us. It is immigrants who keep this economy alive.
They should be stopped before they ever get here. You put up a 20-high-foot fence. I'm tired of hearing this stuff about, well, we're civilized and we don't need to build walls and et cetera, et cetera. Baloney. It is an invasion.
The argument goes to the heart of what Californians are bitter about, that the federal government isn't trying very hard to keep the illegals out and is dumping all the costs for the services on the counties and state.
We have 3,000 people cross a night. 1,000 are stopped. You got to decide, can we provide 2,000 school positions, 2,000 jobs, 2,000 medical care? And if we can't, then we darn well got to talk about how we're going to limit how many people we have to serve by law. And in San Diego County, the federal government is requiring us to serve a lot of people that the federal government should have never allowed into this country.